hind. And as we do, we're going to answer a couple questions like, where are parasympathetic cell bodies located, and what is the pathway of parasympathetic innervation? There are two divisions of the autonomic nervous system, with the parasympathetic division being one of those. And we can remember that it's all about rest, digest, and read here. So when we look at the eyes, the parasympathetic division causes pupil constriction and thickens the lens for near vision. When we look at the heart, it decreases heart rate and strength of contraction. In the lungs, it constricts bronchi. In the digestive tract, it promotes peristalsis. And in the liver, it promotes conservation of glycogen. And to see where the cell bodies are located, we're going to do a parasympathetic pathway nerve trace. So the scenario is a visceral sensory input from the hindgut elicits parasympathetic output to the hindgut. So we'll put up our picture of the spinal cord levels and splanchnic nerves. And then we have visceral sensory input from the hindgut with parasympathetic visceral motor output returning to the hindgut. So we'll start in the hindgut box with a yellow visceral sensory neuron. We'll take that through the parasympathetic splanchnic nerve, then through the ventral ramus, spinal nerve trunk, and then it's sensory, so we're going to go through the dorsal root and have a cell body in the dorsal root ganglion. And then once we're in the posterior horn gray matter, we'll synapse with a pink interneuron. And then just for space, I'm going to use the pink interneuron to cross to the other side, and then we'll synapse with a green preganglionic motor neuron. That motor neuron will then exit through the ventral root, go through the spinal nerve trunk, and then go through the ventral ramus where it can then enter into the parasympathetic splanchnic nerve. Then the preganglionic neuron will take the parasympathetic splanchnic nerve all the way to the walls of the organs of the hindgut, where it will then synapse in an intramural ganglion with a purple postganglionic neuron. And since this is a parasympathetic pathway, that postganglionic neuron will then release acetylcholine at that target structure. And that is the nerve trace for that scenario. So you might be noticing that there are no parasympathetic splanchnic nerves that go to the foregut or the thoracic cavity. So how does parasympathetic innervation get to those locations? That's where the cranial nerves come in, and they're not drawn on this illustration, but there would be cranial nerves, specifically the vagus nerve, that will take parasympathetic innervation to the thoracic cavity as well as the foregut and the midgut. And we'll talk a lot more about cranial nerves at the end of this course. So that's it for our parasympathetic pathway, so let's do a quick recap. Going through that nerve trace, we're able to see locations of parasympathetic cell bodies. We saw that there were visceral sensory cell bodies in the dorsal root ganglia, and then there were visceral motor cell bodies for preganglionic neurons in the S2 through S4 gray matter. And then if we had cranial nerves, there'd also be brain nuclei where we would see those. And then we also saw that postganglionic neurons had cell bodies in those intramural ganglia. And that is it for our recap of the parasympathetic division of the ANS.